So it's been a long time since I saw Dr. Tan. The last time was a few months ago before when we did this podcast. And
Yes.
now that we are back with each other, the weather hasn't been so good. It's very hazy, and I myself actually got the allergies rhinitis, and it's been so bad. It's so bad that like antihistamine is not helping. But I think my main concern is that my nose starts to become really red here. So like from a doctor's point of view, like what could we do to reduce all this redness to not show people that we actually have allergies?
Of course, when the weather is better, that definitely helps. Yeah,
Right.
because the repeated exposure is going to trigger more inflammation, congestion, and all.
Yeah.
But for those people with like persistent redness, that means it lingers on even
Yeah.
after that allergic episode.
Mm.
Is better than treatments like vascular lasers or like Silphoam X would be very helpful.
So what's the difference between these two then?
Mm.
Like the laser and Silphoam X.
Well, laser is a light device, yeah, and Silphoam X is a microneedle radio
Oh,
frequency.
right,
But both we can use to target some of the redness and all. Of
right,
course, if the broken capillaries are much bigger,
right.
yeah, then sometimes we might need to use the vascular laser.
Vascular laser.
Yeah, but overall, the microneedle radio frequency
Yes,
is very popular now
right.
because it has multiple functions,
Mm,
both to improve texture, skin tightening, improving like diffuse redness,
right.
or like pigmentation, or even rejuvenating all around the eye.
So it's like almost like everything, broken capillaries,
Mm,
aging under the eyes,
mm,
and like firming and all
mm.
sort of things.
Yeah, even the upper eyelid because
Right,
it's a non-laser.
right,
Yeah.
right. So like if, for example, like I have allergies and even antihistamine doesn't help me,
Mhm.
is there any like general advice you could give me? What should I be taking? Like any supplements I should be like ingesting or things like that?
Actually, of course, if it's a known allergen, then to reduce exposure
Yeah,
would of course be the best thing,
yeah.
but to manage the symptoms
Mm,
temporarily,
mm.
on top of the antihistamines, some people they take like vitamin C 3
Ooh,
times a day,
wow.
or like quercetin, it can be a good add-on.
Quercetin,
Yeah.
the one that is inside the apple and onion.
Yeah.
Right. So
That's
eat more apples and eat more onions.
of course, this one is extracted, so
Yeah,
it's
right.
the dose is much higher. Yeah.
Right. Okay. Yep. So I think at the end of the day, I feel like in 2026, I think the biggest thing right now is about lifting, right? We see
Mm,
a lot of PRN out there. We see a lot of
mm,
collagen. We
definitely.
see stem cells. I don't even know what terms anymore because there's just so many terms out there
Yeah.
in the whole beauty world. Like, what's your take on if we have a lifting procedures we want to do to uplift our skin?
Yeah.
What's in the market right now?
The quick answer is too many.
Oh my.
Too many. I mean, I get this question quite often, and usually people they are confused about things like, for example, like microneedling, right? Something that a lot of people
Sorry.
they have tried at their facial place, even
Yeah.
like microneedling versus radiofrequency
Mm.
versus ultrasound versus other like lifting treatments. So
Yeah.
what's the difference? I think the easiest way to look at it is to imagine that our face, our skin is like a house. So there are
Mm.
multiple layers. Of course, as
Yeah.
we age, actually all layers would age and
Yeah.
deteriorate.
Yeah.
So depending on what you are actually looking at, what symptoms you are actually looking to improve and to rejuvenate, the
Right.
layers, then we will decide which layer that
Right.
we need to treat. Often, as age progress, we might have to treat all the layers so that we
Right.
get a better result. So, for example, like microneedling.
Mm.
Microneedling is usually targeting the very surface layer. So
Okay.
we are really looking at like maybe improving like pores, textures, improving the absorption of your
Yeah.
skincare,
Yeah.
that kind of thing. So we wouldn't use it for lifting because for lifting, then you need depth.
Oh,
You need
depth.
enough
Okay.
intensity
Right.
you know, and of course it should be done with precision and safety in mind. So to use just pure mechanical
Right.
kind of trauma, like
Right.
that's what a microneedle is, you know,
Right.
it's a mechanical trauma. To have such high intensity and such deep depth, you would imagine it will be painful, there will be
Yes.
like long downtime,
Yes.
and it will be
Yes.
high risk, you know, for example, even like scarring or even infection.
Yeah. Yeah.
Right, so it's more for superficial.
Okay.
Okay, then as we go deeper, we are
Mm.
looking at improving the dermis,
Right.
right? The superficial dermis, deep
Right.
dermis, especially when we're talking about tightening, we are talking about the deep dermis,
Yes.
all right?
Yeah.
Or a little bit into the soft tissue.
Yeah.
That's, you know, in a very simplified way,
Yeah.
that's where most of the radio frequency devices
Oh, so that's radio
regularly are.
frequency.
So
Okay.
microneedle is a mechanical treatment,
Right.
right?
Right.
All the rest that are relatively newer,
Mm.
they are basically what we call energy devices.
Mm.
So they use some kind of energy to reach and stimulate different tissues in the face.
Right.
Correct? So radio frequency is a type of energy. Ultrasound is another type of energy.
Right.
Okay? So laser, like you asked just now, laser is a light energy, and most of
Mm.
the lasers, most of the time we are targeting the
Superficial.
dermis. Yeah.
Right.
That's why we are looking at improvement in complexion. You know, again, pores, acne, dullness,
Yes.
pigmentation, redness.
Right.
Okay,
So
and
that's very superficial, like the epidermis.
no, the
Dermis.
dermis.
Okay.
Okay, and then we
Okay.
can have some of the deeper lasers, you know, like
Mm.
the titanium lift, for example, that
Right.
can go a little bit deeper for like a bit of skin tightening and to improve the density of the
Right.
skin. Correct. So that
Right.
is laser and microneedling. So when we go deeper into the dermis,
Right.
usually that's where most of the radio frequency devices are working.
Right.
Yeah. Okay,
Yes.
so the radio frequency goes into the deep dermis and a little bit into the superficial soft tissue below that
Mm.
to stimulate collagen, right? To
Right.
stimulate collagen, so you improve the overall density of the dermis, all right, by stimulation of the collagen. So what you might notice, like, you know, the skin looks more radiant due to the increased density, more smoother, right?
Mm.
The lines are improved
Yeah.
and the skin is tighter.
Right.
All right, so that is most of the radio frequency.
Right.
All right, and now there are hybrids. You know, we have like microneedle
Right.
radio frequency.
Yeah.
Okay, because the problem with the first generation radio frequency, you know, for example, like the March that we had,
Yes.
is that, you know, some people they can absorb the energy much better,
Yeah.
and other people they simply cannot absorb the energy so well.
Right.
So their results, you know, the pain might be more, but the results are less.
Right.
Okay, so with the invention of microneedle radio frequency, you get you bypass the skin barrier.
Yeah.
You have precision in the depth.
So it's
Right.
like microneedling and they push the energy in.
Yes.
Right.
So basically, I can set the exact depth that I want to reach.
Wow.
Right? Because previously, the radio frequency, you can up or down, you know, the energy, but that's about it. Depending
Right.
on how your body absorbs the energy,
Yeah.
the amount of energy and the depth, really, you cannot control so well.
Yeah.
You know,
Yeah.
so because of the microneedle radio frequency,
Mm.
I'm able to set the precise depth, and
Okay.
the robot arm, you know, sends the energy into that depth through the microneedle. So
Ooh.
you bypass the skin. Actually, it's much safer because you
More
don't
precise.
need, yeah, precise, because you do not need like very high energy to overcome the skin barrier.
So it will not burn and like
Yeah.
stuff like that.
Yeah.
Right.
Okay.
Because usually it burns, right?
Yeah, of course,
Yeah.
if you crank up the energy, you
Yes.
know, to bypass the
It's hot.
skin,
Yeah.
then it's going to have overheating and then
Yeah.
you can burn.
Okay, so I have like a very interesting question.
Yeah.
Recently, I've been scrolling Red Note, which is 小红书,
Yes.
on social media, and I realized that you start to see maybe actresses in their late, let's say, 40s or early 50s, looking a little bit swollen, like here. You know, did they overdo it or what? Like if like, for example, if a client or a patient come in and they have done fillers, they have did Botox, they have done all sort of things, and maybe like, you know, generally the internal muscle group might be a little bit messy.
Mm.
How do we rectify that then with lifting procedures? Is it
Mm.
still possible?
Yes, of course, if it's overfilling,
Right.
then we might have to dissolve some of the filler,
Yes.
assuming that it is a natural filler
Right.
or hyaluronic acid filler,
Yeah.
because nowadays there are many different type of fillers.
Right.
Some are not dissolvable.
Oh, oh wow. Oh wow.
Yeah,
So we have to
so
go to the right doctor then.
yeah, so so being able to dissolve the filler
Right.
or a not so lasting filler, sometimes it might not be a
Bad
bad thing,
thing. Yeah.
So of course, if there's excess, we might have to reduce the excess and then retighten and to reshape the skin.
Right. Oh
Yeah,
wow. I didn't know there's like undissolvable fillers and dissolvable fillers. So
yes,
like right now I guess like the current crowd is more of they want to go for dissolvable lah.
yeah. But humans being humans, people want it longer lasting.
Right.
More stimulation.
Okay.
That's why usually some people they opt for collagen stimulators.
Collagen stimulators are dissolvable
They
or
are not dissolvable. Of course, the collagen stimulator, whatever is injected, usually after a while it
yeah.
will break down,
Mm.
right?
Yep.
Yeah, so but usually it is longer lasting, which is why they are
Right.
they are opted for in the in
Right.
the in the first place. So it might be years. And you do not have a antidote to like immediately make it go away.
Oh, that's so interesting
Yeah.
because like this is something that we don't really
Yeah, so you
hear
have
about,
to yeah,
right?
be patient and
Right.
really wait it out. Yeah.
Yeah, so I guess like the takeaway today is that if you are not sure about the fillers,
Mm.
it's always good to opt for a dissolvable fillers, even though it may feel like in price point of view not as worth it, but
Not as
actually in the
lasting,
long
yeah.
run, it's actually better because we have the flexibility of changing. It's a bit like buying a changeable flight ticket.
Yeah.
You know, you can
Right.
change anytime you want.
Yeah.
So that's like that
Yeah.
options.
Yeah,
Oh,
that's
it's so
advantage.
interesting.
Yeah. So yeah. So a lot of people they are actually opting to, maintain what they have now,
Right.
for longer rather than to opt for the easy way out, the easy way
Like a
out
fixed
to,
look lah.
yeah, just to, fill
Yeah.
and all. So I think that's a great trend.
Yeah.
It's what we call regenerative aesthetics.
Yeah, because I feel like these days we hear a lot lesser of using fillers and Botox, but more of like using radio frequency, ultrasound,
Ultrasound.
even like microneedling has been like a hot topic these days. But
Yeah.
I think like in today's discussion, I feel like I really have a very clear idea of like, okay, it is actually laser first, which is very superficial.
Yeah.
Then if you want a little bit more, you go into microneedling. Of course, you need heat and precision, which is the hybrid of radio frequency and microneedle, and as well as like ultrasound as well. So
Yeah.
that is more of like the lifting treatments, like
Yeah.
ultimate lifting treatments, based on like different steps
Yeah.
and the depth of the intensity of it.
Yeah. So for example, like the typical, of course, now there are so many different devices,
Yeah, so many.
Yeah. Not only in terms of different quality, the range, but also in different technology. But overall, I think when we think about the classic ultrasound kind of facelift,
Yeah.
for example, like our therapy and all, yeah, so they're actually targeting much deeper. So
Right.
we're actually targeting like the root of the collagen tree on top of the muscle. So that's the deep, deep
Wow.
part of the soft tissue.
Right.
Yeah, so that we can improve the foundation. And then now we even have the ability to improve the muscle.
Oh wow, we can improve muscles now.
Yes, right?
Well, like the way you smile will not be too stiff.
Yes, because
Wow.
actually the muscle is like the foundation, right? It's the
Yeah.
reason why we can move properly
Yeah.
and then support all the soft tissue
Yeah.
and the skin above it.
Yes.
And then also the muscle is very important for circulation, right? So
Yes.
we see a lot of ladies and men actually who are concerned about panda eyes, like very bad circulation around
Yes.
the eyes, causing
Yes.
severe dark eye circles that keep on coming back despite
Right.
treatment. So with that improved musculature,
Right.
actually we find that the lymphatics and the blood flow, the microcirculation overall is improved, and
Right.
then that's why it gives us like an improvement even in the skin.
Wow.
Yeah, so it's something that we didn't expect in the
Yeah.
first place
Yeah.
when we do the treatment.
Yeah.
Yeah.
So in that case, what's a good age group to start this lifting treatment? Let's say like from prevention.
Ah, of course, prevention is better than cure. So I would say maybe, at the first sign that you feel like, oh, things are a little bit changing.
But first time for different people is different, right? Some
Yeah.
people will think, oh, I'm 24 and I'm aging. But there are some people like, no, I'm not. I'm 30. Like, I can start maybe at
Yeah,
35.
yeah, absolutely right. No, because we are biologically different. We have seen 24
Right.
that look much older. We have seen like 38
That
that
looks
looks
much
much
younger.
younger than their actual age.
Okay.
Yeah, but I mean, overall, on the average, most people will find that, the body is changing, the skin is changing as they go into the 30s.
100%.
Yeah,
I can swear by that.
yeah,
Definitely feel a difference in my skin as well.
yeah.
Have to really care about my inner health as well,
Mm,
on top of going for treatments
yeah.
in a clinic.
Yeah.
Yeah.
In fact, that is what we advocate. The reason, the biggest reason why, a 25 can look like like 35, and like a 70-year-old can, function like a 40, 50-year-old, they climb mountains, like nothing,
Yes.
it's because, you know, um, aging starts from the inside down to
True.
the level of the cells.
True.
The age is really a number. Yeah,
Right.
so sometimes we get very hung up by the number. We get very
Yes.
sad, oh, I'm
Yeah.
turning 28,
Yeah.
the
True.
kind of thing. But it's not just about the number, it's the biological age, which is why
Right.
people do, treatments for their skin. So they remain biologically younger for longer.
All right, so because like now C drama has been a hot topic as well in the region, especially now in Singapore. And we see a lot of like uh actor and actresses looking really, really good. So if
Mm.
we want to maintain and look like them, um, what should we do? Like what sort of treatment should we do? Like they have flawless skin,
Mm.
like poreless, they look lifted, they look like they have vitality.
Yeah.
Like what should we do if we want to achieve that? Like if a client come to me
Mm.
and say, I want to look like that. I mean, yes, makeup can make you look like that, yes.
Yeah.
But like the skin texture and everything
Yeah.
needs to be treated.
Yeah.
So what would you suggest?
Well, for us, I think we believe in a outside in and inside out approach.
Yes. Yeah.
Depending on uh, where needs the most work.
Yep.
All right. Of course, when patients come to us for anti-aging, usually they come with a set of specific concerns, and that will already tell you which layer you are looking at.
Right.
Yeah, so
Right.
like I say, if it's like more of a complexion kind of complaint,
Yep.
then often you're looking at skin treatments, so
Okay.
like lasers, skincare and all that. But
Okay.
if they're complaining of, let's say, like more sagging, like
Yeah.
the contour is becoming like more U shape
Yeah.
instead of like V shape, then
You
actually
need
you have to go
firming,
deeper,
which is like
right?
the
It's the
radio
soft, yeah,
frequency.
like the soft tissue is sagging. So you might be looking at a radio frequency treatment or ultrasound treatment, depending also on their faces. So, for example, classically, like very lean faces.
Yeah.
Often these kind of faces they tend to lose a lot of
Collagen.
fat. Not
Oh,
only collagen, they
fats.
also tend to lose a lot of fat,
Right.
right? So sometimes, like when we do too much ultrasound treatments, it might be a bit too tight, and
Right.
that like like accentuates, it reveals their fat loss and their leanness a
Oh,
bit too
that's not
much.
good as
Yeah,
well.
so we might choose radio frequency instead. Yeah,
Okay.
so a little bit less deep,
So
more
not
superficial.
ultrasound, but radio frequency.
Yeah, radio
Right.
frequency. So it's more like a skin tightening.
Right.
So that overall the contour and the skin quality is better.
Right.
We might also choose some skin boosters
Yep.
to help them maintain their own plumpness for as long as possible.
Skin booster as a like injectable skin booster.
Yes,
Isn't it
so
very painful?
well, of course, all injection cannot be totally painless, lah, but
Okay.
pain definitely can be very well managed. So
Mm.
so far, nobody has like scream and
Okay, great.
run away. So pain can be greatly managed. I think it's more the fear. the
Yeah.
fear of the needles,
Because I feel
of the
like
injection.
in this region,
Mm.
I definitely think that guys would probably quietly think, oh, how do we look like the actors and stuff? Because they look really fair and really, really flawless.
Actually, a lot of men they are starting to do all
Yeah,
these
that's why.
treatments.
That's why I'm just
It's
thinking
not
based
only
on
for the
for
ladies,
ladies, right?
yeah.
Because I feel like from a man's point of view, they really have very little knowledge. Okay,
Yeah,
maybe not, maybe I'm wrong, but basically
yeah,
I do feel that they probably want to find out more, but they don't know how.
yeah,
So I think that like this is also good because they now know that okay, they can look like
yeah,
the actors or anything just because there's all these treatments at any stage and any point of time
yeah.
whereby they can enter based on
Yes.
their phases.
Yeah, so actually a lot of the men they start off with because now there are so many non-invasive treatments. So many of the male clients they start with like non-invasive treatments,
Because they only know pico laser, I realize. They always
Yeah,
tell me, oh,
everybody
I
know.
done pico laser. I'm like,
Yeah,
okay, great.
yeah,
What's next then? They're like,
yeah. But pico
yeah.
laser being a laser, right? And a pico laser is best for like pigmentation. Of course, it does help with texture and all that because it's a laser, right? It's a
Yeah.
skin treatment, But a lot of times, depending on what they are complaining, so if they are noticing like the brows are dropping, the eyes are dropping, the eyes look more tired, then the pico laser is not going to cut it lah.
Okay, but maybe okay, so from a guy's point of view, I think that what they would from what I observe, they would probably want muscle contour. Like they want to look more contoured or chiseled. Is
Yeah.
it possible through like machine treatments?
Yeah, of course, a lot of times, the male face is already more, more square and
Yeah.
wider. So a lot of them actually they come to us complaining that they are losing that definition.
Right, yeah,
They
yeah,
are
yeah.
losing that
They're
definition.
looking more and more you.
Yeah. So basically, it's like some of them they tell me like my face is like melting away. That kind of thing. Yeah.
Yes.
So basically they are saying that they are losing that definition and contour. It's not like they want like more contour, like
Yeah.
filler injections and
Yes,
all,
yes.
rather than to rejuvenate their face naturally. So
Yeah.
in that case, there are many treatments that can be done. For men, a favorite starting treatment is actually the Emface, which is
Or
the treat. Yeah,
Emface.
which is the treatment that targets the muscles.
Right. And
Uh,
it's painless
yeah,
and
it's
it's comfortable.
painless, it's quick, it's 20 minutes. Yeah, it's effective. So it strengthens your lifting muscles specifically, not the
Yeah.
ones that help
Yeah.
gravity that pull you down,
Yeah.
just the lifting ones. Increases the resting tone. That means even when you're not, using your muscle, the muscle is stronger, plumper, in
Mm.
a better position. So the face look naturally more lifted and contoured.
Yeah. But it's also not like one treatment fix everything. You definitely still have to go for a
Oh,
few rounds of it.
yeah,
For sure.
definitely.
Like maybe a year you will see a difference.
Yeah.
Or like how short a time do you think they would see something?
Well, it depends on how they live their life because, like I say,
Oh yeah, so
yeah,
it's the lifestyle as well.
yeah,
Okay.
because it's also the inside out. So a stressful life is very common nowadays. Like I haven't seen a
Yes.
person who is not stressed nowadays, right?
Yeah.
Yeah. So, but it depends on how stressed they are and how else they are taking care of
Yeah.
themselves. So, a lot of patients because it's so easy, it's so quick, they don't want to wait until the results are totally gone.
Yeah.
So actually a lot of them they opt to do like a small maintenance, 20-minute maintenance, like 3 months down the road.
Right.
So every quarter they do one, so
Okay.
that they maintain, rather than waiting like 12 months and then they do that program of 4 sessions all over again
Yeah.
to retrain their muscles. Yeah,
Okay. So
yeah.
it's consistency in like paced out quarterly manner
Yeah,
is
actually, that's
better.
what a lot of people prefer. But of course, if they are unable to come, then it's also okay to do it like
Yeah, which most of them they will just say they are not okay to come every quarterly.
yeah,
Yeah.
yeah. But actually, most people they want to maintain because
Right.
they like what they see.
Right. So 20 minutes is enough to actually maintain on a quarterly basis.
Yeah, so it's not a bad idea. And
Yeah.
honestly, nowadays we are layering the treatments
Yeah.
because, like I said, actually all the tissues would deteriorate.
So basically it's a little bit like, yes, you can have very good ingredients and but now a aesthetic doctor is a little bit like a chef,
Yeah.
whereby you need to curate a dish based on the preference of the person
Yes.
and come up with like a layering of
Of different
treatments instead
treatments.
of like just Hokkien Mee only. But now
Yeah.
there's a mixture of Yuan Yang or whatsoever.
Yeah, because
Right.
there is no one treatment that would treat all the different layers, the
Right.
different tissues, you know.
Wow, so interesting.
Yeah, so usually we might, layer, let's say, for those people with more signals sagging, we might layer the Emface with, let's say, the ultrasound. Or
Right.
if they have both sagging and complexion issues, we might layer, let's say, the Emface with, let's say, the Silvermax, which is a microneedle radiofrequency
Yeah.
that is very special,
Yeah.
that treats, both complexion and a little bit of tightening.
Yeah.
Yeah, so yeah, it depends.
Wow, so interesting. I think today we definitely
Yeah,
shared a lot
it's
about
it's
it.
like it's like makeup, I guess,
Yeah, it
right?
is. Yes. Yeah, it
Yeah,
is.
it's the mix and match that the
Yeah,
mix
every
and
face is
magic.
different,
Yeah,
definitely.
yeah,
And like how you
definitely.
contour every face is as well is very different.
Yeah.
Where do we find like how do we make it look more 3D? I think it's different.
Yeah,
From that point of view, I think structurally we also look at muscle as well on like how
right.
the muscle reacts when our client talk
Mm,
or like smile,
mm.
then that's where you adjust. I think it's the same for like aesthetic treatment as well.
Yeah, it is the
It's just
same.
that I feel like with aesthetic treatment, a lot of people don't understand because they open the menu and there's a lot of like treatments that they do not understand. They don't even know what's ultrasound. They
Mm,
don't even know what's microneedling. They don't know what's radio frequency. And I think today we share a lot about like okay, that's different steps and like how deep they penetrate.
yeah.
Yeah, which I think is very good.
Yeah.
Yeah.
Actually, it's not
Yes.
so confusing. Of course, the confusing part is all the details because there are too many devices and then some
Yeah.
straddle like the in-betweens,
The hybrids.
Yeah, the
Yeah.
hybrids and all that. But basically, skin, you have your microneedle, you have your lasers, okay? And then there are different kind of lasers because different lasers will target different
Yeah.
complexion issues better,
Yeah.
you know. There is much more in this world than pico laser,
Yeah, for
definitely,
sure.
for sure.
For sure.
Yeah, then the soft tissue, and the deep dermis, you have your radio frequencies, can be uh, like just normal radio frequency, monopolar radio frequency with no needles, and then the newer generation are the microneedle radio frequency.
Yeah.
And then deeper than that, we have the ultrasound. Of
Yes.
course, now some of the newer ultrasounds, like the soft wave, are going with the reverse trend. So it's going back into the deep dermis and the superficial
Ooh.
soft tissue in a new type of ultrasound technology so that it creates tightening, improves like scarring,
Oh wow.
right? Because scar, you need to treat a little bit more
Yes.
superficially. So the good thing about that is like even for those patients that have scars that do not want downtime, then that kind of ultrasound because it doesn't break the skin,
True.
right? It's a walk in, walk out kind of
Yeah,
treatment.
but I think the most cool thing I
Mm.
heard today is that there's actually treatments for like under eye and dark circles.
Yeah,
Because that's something I think a lot of people actually have issues with because we
yeah,
look at the computer all the time and
yeah.
we somehow have like dark circles and there's no way out, right? Like eye cream might help to a certain extent,
Mm,
but it does not resolve the problem.
mm.
And I think that itself is a very interesting treatment that now in this market we have something for it.
Yes,
Yeah.
definitely. Yeah. Eyes are always inherently more difficult, right? Because of the nature
Yeah, it's
of
also
the
very
eyes.
precious.
Yeah, and
Yeah.
all. So, of course, safety is the number one consideration. That's
Yes.
why it's more limited compared to, let's say, other areas of the face. But definitely, actually, because commonly a lot of people, like you say, because too much, near activities,
Yes.
they always overstrain their eyes,
Mm.
it's always head down,
Yes.
they don't move enough, so the microcirculation is very poor, and then especially with aging, as the skin thins, it really shows off, that underlying vasculature.
Yeah, but like if like they can treat dark circles, right? Can
Mm.
they also treat eye bags? Like
Yes,
sometimes we have like that random baggage underneath.
yes,
Yeah, oh that helps as well.
yeah, that's where
Ah.
Emphase comes in
Oh,
because,
that's
yeah,
Emface. Okay.
because I mean, eye bag not only puffiness, yeah, like some of
Right.
the water retention, like eye bag, especially we are talking about milder, the early stage eye bag.
Yeah.
Yeah, it's starting to show a little bit of the fat
Yeah.
herniation, right? Basically, eye bag is the fat
Right.
herniating out, you know,
Oh.
the muscle is cannot hold anymore. The skin is like also there's laxity in the skin, right? So that's the fat problem.
Oh, that's a fat problem. Well, eating more fat helps.
No, because it's the fat herniating out. You know, it's like the
Oh,
belly after
or protrude
pregnancy
out. Oh, okay, okay.
coming out, right? Okay, so what Emface does is that it will actually tone up the
Oh,
muscle and tighten the skin at the same time to some degree, so that you can hold back the fat. I think Asians, like Chinese especially, we are quite prone to having early eye bag because of our bony structure. We
mm,
tend to be relatively flat medially,
yeah.
this bone. That's why the support is less. So a lot of the Chinese, we tend to have like the eye bag problem earlier.
Yeah, I
Yeah.
see a lot.
Yeah. So
Yeah.
this is where, treating early is very important.
So
Ah,
like my age, I can start treating
yes.
before it comes and find me.
Yeah. So it
Okay.
improves
That's
the
one baggage I never want.
yeah. So it
Yeah.
improves, like even like puffiness, like ladies, because we have our hormonal cycles, we are very prone to like puffiness
But if I want
sometimes.
to prevent like let's
Mm,
say eye bag forming,
mm,
right, in my future self,
mm.
how many treatments should I be looking at in a year for prevention?
Usually for Emphase, because yeah, the main thing is to train the muscle, to tone
Right,
up the muscle, to
right.
rejuvenate the muscle. So usually most people would need like a course of 4 sessions initially.
Oh,
Uh,
like in a year lah.
no,
Oh,
initially. So
initially,
it's
okay.
done like once a week. You think of like going to the gym,
Wow.
right? You go to the gym, you must at least go to the gym once a week,
Yeah,
right?
true, 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 true.
Otherwise, it's not going to build muscle.
Yeah,
So
you're right.
you go to your skin gym once a week. Then after that, you allow it to react over the next 8 weeks. Yeah, and then after that, to maintain, you can choose to do 4 times 1 year later, or most
Oh,
people actually they prefer to do one every quarterly.
quarterly, okay.
So
To
that they
create
don't have
that memory.
yeah, so that they don't lose the results, because
Right.
for a lot of people the scheduling is a problem to do 4 times, regularly
Yeah
once
lah,
a
that's why a
week.
lot of people don't sign up
Yeah.
PT as well.
Right, it's the same problem we have going to the gym. Yeah, so they will rather do one every quarterly, to
Right.
maintain. That's what most people actually prefer.
Oh, interesting.
Mm.
I think with today's discussion, or rather like sharing, I think we really learn a lot about lifting, as well as like the different types of lifting we have in the market,
Mm.
and when you should start, and how like every phase is different.
Yes,
Yeah. So
definitely.
I
So
think it's
there
a good
is,
sharing.
yeah, so it's like makeup. I think there is artistry
Yes.
to it as well.
Yeah.
Yeah, definitely.
But this is definitely very good insight.
Thank you.
Yes. Yay.